So let me just say that I am a huge advocate of cross-training. Now, I want to get a little bit more specific about it. I think there's many ways we can cross-train, but let me get very specific about it. Let me share with you 5 specific things that you could train your dental assistants to do if they were needed at the front desk. If they were needed. 5. Now, they're not, I want to be clear, we are not training them to the same degree of competency as our admin team members. We're not, that's not the expectation. Not the expectation at all. But I want to share with them 5 things that we've proven in my coaching work, proven at Life Smiles, but we also proven in our coaching work, that we can train assistants to do very effectively up front when needed. Let me walk through those. I'll number them 1 through 5. Number 1, check patients in. Check patients in. Every practice should have a check-in process when a patient shows up for their appointment. Number 2, check patients out. At the end of their appointment, we check them out. That's the second task that your assistants can be very effectively trained to do. Number 3 might be part of the checkout process, but I think of it as a little bit separate, but part of. Handle over-the-counter payment when checking out. So let's say there's an over-the-counter payment for today's hygiene appointment. Well, they should be able to handle that right at the front desk. Handle it seamlessly, smoothly, efficiently for the patient and the practice. Number 4, your dental assistant should be able to make financial arrangements for everyday general dentistry. So let me talk about that. So let's say the patient has gone through a hygiene appointment today, and doctor discovered there were some areas on the upper left that require fillings, and now the patient is going to be scheduling for those fillings. So everyday general dentistry. So your assistant, who's now covering at the front, as part of the checkout process, should be able to handle payment today for the hygiene appointment, but also schedule and make financial arrangements for those fillings on the upper left. That should be something well within, a dental assistant's capabilities, for sure. Now, notice, Maren, I'm not talking about high-value dentistry. I'm talking about everyday general dentistry here. I'm not talking about being able to make financial arrangements and scheduling for a full mouth reconstruction. I would say that's something that's more specialized and should be handled by our admin team members that are more well versed in that area. Does that make sense?
Yeah, absolutely.
And then finally, number 5 is anyone that's covering at the front desk should be able to answer the phones regarding a potential new patient caller with the same conversion percentage that our rock star admin team members exhibit. Remember we've done episodes on conversion percentage. Conversion percentage, doctor, is what percent of callers that are potential patients end up scheduling a new patient appointment. And the goal that we're looking for is 70% or above. 70% or above. It's not 100% because that's not realistic, but we want to get a score of 70% or above. Now, we should be able to train your admin team members to be able to do that, or your assistants to be able to do that at the same degree of success that your admin team members have. Now, they're not going to know that just out of the box. They're going to have some training to do that, because that way I'm not affecting my new patient flow, because I'm expecting the same degree of performance that my rockstar admin team members have. And with a little bit of training, they absolutely can achieve. Naren, you've seen that in our mutual clients. You've seen how we've been able to do that.
Yes.
Yeah. So there's 5 very specific things you could train an assistant to do and to cover up front when needed. And that door swings both ways, Naren. Our admin team members should be able to cover in the back, Life Smiles, we happen to have 2 admin team members that were former assistants. Now, it's kind of cool that they were former assistants because they have some education and training around that. But even if your admin team members weren't former assistants, there's some things they can do up front, or they can do in the back, in the admin side of your practice. For example, I believe every team member should be trained to be able to do sterilization of instruments in your practice. Every team member should be able to do it. Now, it's going to take some training, and it has to be done to a high standard because we don't want any lapses when it comes to sterilization. But they should be able to handle sterilization of instruments in the back. They can function as an assistant not necessarily with the same degree of skill that your really great assistants would do, but they should be able to function as an assistant in the back, handing instruments, or at the 12 o'clock position, doing data entry when needed. Another task that I think everybody in the practice should do is everybody should be able to take the 6 digital photos that we take for patient education. Those 6 digital photos. Now, typically, that would be more of a clinical team member role to take those photos.
Correct.
But if on a given day our assistants are occupied and we have a patient that we'd like to take those photos on, I don't want to miss the opportunity to take the photos, so we have no one to take the photos.